Okay, the wellness challenge. It's very simple. We're gonna talk about wellness. We're gonna talk about brain wellness. We're gonna talk about being physically active, mentally active. They go hand in hand. Okay. We got some games we're gonna play to demonstrate, and we're gonna make some suggestions to you, but we're gonna do some health education prior to that. So if you go to the next slide, please. We're going to identify 3 features of promoting good health. Identify 2 health screenings that you need. Many people don't realize that there are actually health screenings for your brain. And I'm not talking just about imaging, but I'm talking about some other things. Identify 2 immunizations for disease prevention. Identify 2 ways to prevent complications from diabetes. Describe 2 ways to improve bone density, questions and answers. That's our objectives in brain games. Next slide, please. I'm going to ask you questions. I want you to think of the answers, okay? And then I'll go over the answer. Then you're going to know either whether you were right or you were wrong, okay? And what it's about. Too much of this can raise blood pressure, heart rate, and cholesterol levels. Cortisol is a hormone that helps control blood sugar levels, regulate metabolism, help reduce inflammation, and assist with memory formulation. Assist with memory formulation, okay? Next slide. Think about what that is. Okay. Well, the answer, let's go to the answer. See it over there? Yeah. That little arrow, click on that arrow.
This arrow?
Yeah.
Okay.
I'm sorry. Oh, the answers are coming up with it. All right. I'm sorry. I didn't, yeah, it's read it, cortisol. Cortisol is a hormone in your body that does all of that for you, okay? Doing this at least 30 minutes a day can help reduce early death, heart disease, stroke, type 2 diabetes, and high blood pressure. And I think you know the answer there should be exercise. Okay, exercise. We need to exercise because, and exercise is any type of resistance. I've talked to you about this before. Any type of resistance and movement with the body. Doesn't have to be heavy weightlifting and doesn't have to be a 440 sprint. It just has to get the body moving, and then a little bit of exercise that includes resistance, like maybe lifting books and things like that. Just stuff to make sure you keep your muscles and your body active. That does a lot for your brain. Next one, here's the question. This addictive habit narrows blood vessels and is a risk factor for heart disease, emphysema, and certain cancers. Now, not only there, in case none of you have ever seen it, that's an old-fashioned vape. Okay, that's old. They don't even use them like that anymore. Now they have these thin, very thin things that look almost like a pen holder and stuff like that, or a pen. But any smoking of any type of tobacco, any type of vaping, inhaling that just destroys everything that's right there, okay? And especially the blood vessels in the brain. You'll find out sometimes, and think about it. Remember when you were a kid, if you did this, your first time you ever had a cigarette and you inhaled it and you got dizzy, it quickly reacted to the brain's blood vessels and was closing the brain down. And that's what caused you to become dizzy. Next slide. This type of breathing helps to reduce stress, okay? You exhale out the mouth, inhale through the nose. Simple as that, okay? This is a very good exercise because your brain needs a lot of oxygen. What carries the oxygen to the brain? Well, it goes from the lungs to the heart, through the blood vessels, okay, up to the brain, okay? Your aortic artery, upper one, is the one that causes most of that oxygen to get to your brain. If you cut the oxygen off from the brain dies. And once the brain dies, you're not coming back. Next slide. This screening is done by a healthcare professional when someone is feeling down, sad, or hopeless. Here's a screening. There is a screening for mental health. And that's what we're talking about, mental health. And we're talking about our brain. If you have any of these feelings whatsoever, and they continue, or they happen frequently, go and see your regular doctor. Your regular doctor can give you a screening, okay? It's a really simple screening. It's not physical, it's actually mental. He's going to ask you a series of questions and evaluate your answers. And then he will probably make a recommendation either for you to do something on your own, or if he thinks the problem is that serious, he'll reflect you to someone that can help you further than him or her. Next slide. With this screening, a healthcare provider measures you up by wrapping an inflatable device around your arm to squeeze the blood vessels. Okay, that cuff, that thing, the picture shows off right away your blood pressure. Again, we're going back to talking about blood, okay, and carrying oxygen, not only to your brain, but to the rest of your body. It's essential. Next screen. During a woman's wellness visit, okay, her provider will collect cells from the cervix to be examined for the presence of precancerous cell growth. This month is cervical cancer month, in case you didn't know that, all right? I'm actually doing it the last week for the senior citizens in Montclair, a presentation on cervical health. It is very, very important that you have these screenings, okay? And obviously it's a screening, cervical screening, okay? Pap smear, you need that, gentlemen. You don't have to worry about that, okay? But you can for your wife or your girlfriend or even your sister. Next slide. Wellness, okay, this screening should be done every year for women starting at age 40. The baseline of first mammogram should be done between ages 35 and 40. This has been very controversial. This wellness challenge that we have still believes, Horizon still believes, and obviously still pays for your mammographies. Why I'm saying is that came up as a problem is that they started to make changes in the suggested ages, and they were worried, and they were even saying don't bother with self-exam anymore of the breast. We couldn't believe that. They were saying they were getting too many false positive results of self-breast exam. It saved my two sisters' lives very early in their years because they were doing that and found lumps and had the beginning of breast cancer and had to take care of. In fact, one of my sisters turned 70 today. Make sure you do self-breast exam, learn how to do it correctly. Remember that it starts up here, okay, not just down there, not there, but up here. Slow movement, okay, going around and cover outside all the way through. It's a great thing to do for yourself when you're in the shower. Just do it once a month. Remember the first day every month, do that. Have you talked to your doctor about when you should get your mammography, at what age? At our ages, we should still be getting them, okay? And men, you can get breast cancer, so it doesn't hurt for you to make sure you check yourself out either.
May I mention something?
Mm-hmm. Yeah.
The breast exams and mammograms are for males and females, not only females.
Yeah. Yeah.
Yes, I just said that. Yep.
Oh, I was not listening. I'm sorry. Thank you.
You're welcome. Next slide.
Yeah, I don't think, Vince, before we move on, I don't think there's enough awareness about that. You know, I mean, I'm glad you mentioned it, and I'm glad Jennifer mentioned it, because I was going to mention it if neither one of you did. I know a gentleman who is a breast cancer survivor, so I think it's important to get that out there. I think it's just something that, you know, men take for granted.
Thank you. Well, I'm glad you mentioned it, because this is what I actually did. I used to do mammography, and I did it on males and females. So.
Oh, okay.
Yes.
Oh, good.
You're a radiologist, then?
Yes, I am.
I didn't know that. Wow. Well, you're such a Renaissance woman. You do so many things.
I've been around.
Do you know if there's a baseline age for men? Same?
No, actually, there is no baseline for the men. A lot of times doctors will go over that very quickly because most men have big heads and with knuckleheads. We don't get this. Don't concern me, blah, blah, blah. And unfortunately, we are not taught that, okay, or not informed about that, that it's very possible and you should look out for it. It's a much, much, much lower percentage rate of
Mhm.
than for females, but it still occurs. And in actuality, I do know a gentleman that died from it because
Mhm.
he had a lump in the side of his chest and he thought it was just that and he never brought it up. Next thing you know, it was too late and they couldn't do anything for it.
Mhm.
The bottom line is that any lump in your body is not supposed to be there
Right.
or put together that way. So anywhere in your body, you should be going to a doctor and say, hey, doc, I got this lump. What are we doing here? But the idea is that it has been taught, I would say, or presented much more frequently in the last 10 years.
Mhm.
Males do have this problem and should be aware of it. I know that when I was the school administrator at the new school that I had gone to, I asked to see the curriculum of health education. I wanted to become familiar with it. And what happened is that there was no mention of this in there. And I immediately said, that's going in there. You got
Mhm.
your students, your male students about this.
Mhm.
Um,
So in other words, it's for men, it's not a, baseline mandatory, it's self-check. And then if you find something, you go to the doctor and you have it checked out.
yes, yeah, basically that is it for males.
Yeah.
It's not that prevalent that they should be getting a mammogram.
I think the other thing that I've noticed, Vince, in talking to older women, particularly women that are seniors, is women my age and younger. Like I'm in my mid 50s now, and women that are in their 30s and 40s, and now women in their 50s. We have this conversation about the day we go for our mammogram, and we talk about it like, oh, it's and we sometimes, it's a celebrated thing in our community. I think for a lot of older women, it's something that is sort of, I don't know, I don't know if this is just, if I'm hearing this wrong, but I hear a lot of women say, oh, I haven't gone in years, when they get older, 75, 80, 85, where people just kind of let that go. But I don't know if that's a universal truth or if it's, I don't know. Doctor not recommended. Do you know if there's a cap on age, or is it still recommended for women to go regularly?
They've changed the guidelines like 3 different times in the past 10 years. But the final guideline is that they're talking about up to 75 years of age.
Okay.
Uh,
Okay.
But it's still, I would never say stop doing any self-exam.
Mhm.
Strongly recommend self-exam every year you're alive. So you
Mhm.
have more years to be alive. Um, It's probably something that a lot of folks, we do this to ourselves all the time. At this age, I'm not worried about anything.
Right.
Uh, I had a gentleman when I was doing the nutrition thing, and he says, I'll be damned. I'm 70 years old. I'm not changing what I'm eating now. I made it to 70. I'm okay. And I'm watching him. He's got a pack of Bubba's in his chest pocket, and he's eating nothing but fat off the pork chop. And I'm saying, like, well, do you want to make it to 80? And the guy looked at me and he went, I really don't care. So you can't talk to people about like
Yeah.
that, okay? Because they've set themselves and that's it.
Mhm.
But ladies in this group, regardless of your age, still stay with it. Stay on top of all of the screenings, okay? And the gentlemen too, of course.
Okay. Thanks, Vince.
Sure. Beginning at age 45, men and women should have this procedure done that lets your doctor look inside your large intestine for a type of cancer. Okay, I think we know what that is. Colonoscopy. It's a great screening. Okay, you actually, if you are at a certain age, they tell you only once every 5 years now. And everybody that I'm talking to now, they're talking about you only need it once every 5 years, unless there are problems. Then you might be told by your regular doctor that you should go see about getting a colonoscopy. But it's one of our high rate cancers that cause death. So make sure that you are aware of what the symptoms are, okay? If you start to have problems with your colon, black tarry defecation, pains that go up and down or left and right in your stomach area, being constantly not being able to go to the bathroom, defecate and things like that. So, but beginning at age 45, both men and women should be having this procedure done, and that's called a colonoscopy. And again, if it's clean or they only take a couple little polyps out of there, they'll probably tell you you've got 5 years. And as you get older, they even tell you it might even be 8 years or 10 years, depending upon the history of all your screenings that you've had. Next slide. This screening, which is a blood test that is usually done when fasting, is important to the prevention of heart disease. What are they looking for when they take your blood? They look for about 24 different things, but this particular one, they're looking for what? Cholesterol. Cholesterol. What does cholesterol do? Blocks the arteries. The arteries get blocked, the circulation stops, the heart stops. So you have to get those blood tests to make sure your cholesterol level is maintained. Usually in the beginning, if you have high cholesterol, they'll tell you improve your diet, okay, and give you some medication for it. We can control our cholesterol, all right? Next. This seasonal vaccine is recommended for all people 6 months and older every year. The flu, okay? Flu vaccine. And even though we're in the pandemic and we are now getting the vaccine for the COVID-19, you still should get your flu vaccination. It's two different things. So don't forget about your flu vaccination this year. Make sure that you get that also, okay? Next slide. These vaccines help protect you from liver disease. I always forget this one for some reason. Hit the arrow on the bottom left, please. I can't. No.
I don't know why it took me.
No. Go back to where we were. Wow, I can't remember. I always.
Is it hepatitis?
Yeah, thank you. There you go. Never remember that. I'm gonna write that in there. I gotta do that because I feel like a fool when I never remember this. Thank you very much. And that's the lady that used to give the screenings, breast screening, correct? These vaccines help protect you from liver disease. You don't want to mess around. You don't want to get hepatitis, okay? You can be vaccinated for that. They've gone away from that a little bit lately. The doctors feel that might be a situation that goes 50-50, but talk to your doctor about it. Anytime you have any questions, always talk to your doctor. Next one. Okay, this booster is usually given every 10 years or earlier if needed. Helps protect you against a bacterial infection, affects your nervous system, leading to painful muscle contraction, particularly in your jaw and your neck. Jaundice, okay, and the booster is the there's no oxygen going to my brain today.
Tetanus shot, yes?
Tetanus shot, there you go. I'm sorry about this. I just like it's going, Brad. You know how many times I've shown this and my brain's going on me. It's the tetanus shot, okay? When we were kids, we had a problem. We used to step on nails too often. I remember that. We'd be running to get that tetanus shot. Next one.
Can I ask you, Vince, do you recommend adults? I mean, tetanus was a part of that childhood thing, right? But I don't, like somebody asked me, I had a cut like a couple years ago and somebody says, when was your last tetanus shot? When I was 10 or 5 or 6. I mean, I don't get tetanus shots, but every 10 years, is that really, can you just go into a doctor and say, can I get a tetanus shot preventatively?
Yeah, absolutely. Talk to your doctor about that. That's a vaccination that helps you. One of the things you got to remember that at our age now, when we have an opening in the skin and we get an infection, our body becomes more susceptible to getting sepsis, which is basically a whole body inflammation, okay, which can kill you. Tetanus can ward that off, okay? You gotta remember that our bodies slow down. They don't stop on us, okay, but they slow down, and we become much more susceptible to a lot of diseases that we have to prevent, and that's why we talk about these screenings. So talk to your doctor next time you go and see if the doctor recommends getting a tetanus shot, because it is possible to get an infection which leads to sepsis. We don't want to have that. Next slide.
I know my son has a, and I'm sure that this is going to be a topic going forward. I mean, we learn from things that happen in history, and then, you know, something terrible has to happen before we actually do something about it. But I think this might come out of this whole COVID thing. I know, you know, with my son, you know, he was vaccinated, we had his records, and they sort of follow him along. But then you become an adult. Like, I know my mother has my vaccination records from when I was little, but like adult vaccinations, like I would think that, you know, you have a healthcare provider and you get like a shingle shot, and they know you need it, you know, you have to have that booster shingle shot, or your doctor's keeping track of your boosters and your you know, your flu shot records.
Yep.
Right. I mean, that's one of the challenges, for, you know, people my age without, I haven't had a primary care physician for a really long time. You know, I rarely get sick, knock wood. I run to the Ameti Center. I mean, is there some, do you know, is there some like health database that remembers all the things that have happened to me in my health history? Like, if I've had like, in the last 10 years, I've had probably at least 10 or 12 different healthcare insurance companies. Like, is there some metadata that carries all of my history that I don't know about? I mean, I'm sort of like,
No, there is not.
okay.
There definitely is not. That's why it's always practical to have a primary care physician, because nowadays, through our wonderful electronics, okay, or all the data is usually stored by the primary care. For instance, if I go for any type of surgery, okay, that automatically, they ask you when you go to that doctor, okay, let's say you go into a urologist because you're having problems. Go to a urologist, and the urologist, right away, they want to know is who is your primary care, because they send whatever test and reports or procedures to the primary care, because the primary care is the one that is saving all of your health records for you. Now, if you have scattered your primary cares, always have, if you're going to go from Dr. A primary care who retires to Dr. B, make sure the primary A doctor send your next primary care B doctor all your records. Let them follow you. If you don't do that, they may not do that. So you have to insist on that. Or if that doctor is retiring, let's say, you can ask them to give you your file, and you can hand carry that to the doctor. Make sure that you do that, because that's a great point you brought up. If you don't have a primary care, and you got to go see your urologist, you got to go see a cancer specialist, you got to go see a brain specialist, but you don't have a primary care, then all your health records are spread out only with those individual doctors.
May I suggest something?
Yeah.
Sure.
Since we do have time right now, if we could all just kind of make it a project to make a list of all the different medical conditions and inoculations and dates, you know, just like a brief description of what happened when I broke my arm in 10 years ago, and I had a colonoscopy 3 years ago. Just make a list of it all so that you can at least have your own record right there to pull out in case of any questions. That would be my suggestion.
That's a great, you know, suggestion. Also, allergies. I mean, people ask you that over and over again every time you fill out one of those forms when you go to a new doctor. But it's a good idea. I know some towns have, I know when I worked in Verona, they had something called the Vial of Life, which, God forbid, if something happened to you and the emergency EMS came, they would go into your refrigerator or your freezer. We had like a designated spot, and you would have this vial with your, you know, your blood type, like emergency, you know, medical condition, if you were diabetic, because how would they know? We don't have chips embedded in us. And many people, even when they're diabetic, don't always wear the medical jewelry. If you have a heart condition, if you're taking a blood thinner, there's all kinds of things that, you know, if something were to happen to you in an emergency situation, I always think about that, God forbid, like in a car, you know, you're driving. I mean, you know, there's no, you know, those little cards, you could fill out that on your phone. I'm sure that the police and EMS have a way to to access, right? Don't they have a way to access your emergency medical info if something were to happen to you, right?
Yes, all phones actually have that spot where you can actually put your emergency medical information down.
It could save your life, right? I mean, it's kind of a, it's kind of important. Do you know that I still, and I mentioned this and I'll let you move on. I still don't know my blood type.
Ah.
I mean, it's just crazy that nobody will tell me. I had surgery, or I tried to have surgery last year. They did all the blood work on me. I called that doctor. Oh no, I can't seem to find it. I just had a full workup. You have a full workup, and am I reading this wrong? There's a full workup on every single, you said 23 different, tests they ran on my blood. I just want to know my blood type, like simple, and I can't seem to find it. I've called, I've tried to get it. That should be like the number when they open my chart, they should say she's type O or type, B, whatever. It just drives me crazy. So I guess I have to make an appointment and just have my blood drawn just to find out what the blood type is, because nobody can seem to tell me, but it's a sort of.
One should be able to know your blood type and be able to remember it, because who can remember if it's O positive or B positive? You have to have a way of, remembering if it's an O or B or whatever.
Kind of important.
I know my blood type myself, but I think it's O positive, but I'm not sure.
So many people know their blood type. There's a good question, right? Do you
Yeah.
know your blood type? That's something that we can do today, Jen. That's another great suggestion. Find out what your blood type is.
If you've had surgery, there is a record of it
Yeah.
from the hospital when they do a pre-test.
And Michelle, if you ever give blood with the Red Cross or whatever, they always give you a card with your blood type on it.
So how do they know what it is?
They test it.
When you give blood, they test it.
Yeah, they tell you, you'll get a card saying you're this blood type if you ever gave blood.
Maybe that's the solution for me. I just have to donate.
Yeah,
Yeah.
blood.
Right.
I
Okay.
but they won't take mine
Oh,
Well,
because I'm always low on something.
oh.
I'm low on everything, but I feel quite normal. So
All right. Let's go to the next one. There we go.
It is recommended that adults 65 years of age and older get 2 forms of this vaccine against this homobacteria that affects their lungs. Who wants to give me the answer? I've been asking you for the answers all along.
Pneumonia vaccine.
Sure. We forget about that one a lot, okay?
Yeah.
But
Shingles and the
that's a
shingles
great
vaccine.
important one, again, because our lungs aren't as strong as they used to be. And if we can get a vaccine that will help us, might as well get it. Next slide.
Just to be clear, that was pneumonia. The answer to this was pneumonia, correct?
Yes, pneumonia.
What are the 2 forms?
oh,
You have to have 2 doses of the pneumonia vaccine.
it's called a pneumonia vaccine or a shingles vaccine.
No, pneumonia is different from
No,
shingles.
It's pneumonia, and there's 2 different forms according to your age and your health background. That's the
Yeah.
difference.
Okay.
Doctor will know that. Vaccine recommended for people 50 years of age and older. Studies have shown that this vaccine is 97% effective in preventing this painful disease. Now we're talking about shingles.
The shingle.
Shingles is, and you have to get 2 shots for shingles. You got to get the regular shot and then a booster shot. A lot of people don't get the single shot because they don't think about it. And a lot of times the primary cares aren't thinking about it either. But my wife about 5 years ago got the shingles and it broke out on the side of her head, down the side of her face and neck. And I saw the excruciating pain that she was in. Let me tell you, I ran to go get my shingle shot because I had forgotten about that too. You don't want that. It's just,
You can't catch it. You couldn't catch it from your wife. You just didn't want to get it.
no. So, well, yeah. You have to have the makeup of it in your body already from a childhood disease that
Chickenpox.
which is the measles. Okay. And what happens is that most people think that you can spread the shingles.
The
to a
chickenpox,
person.
right?
You don't. You
Yeah.
can't give them shingles. But what you can give them is the other disease if they've never had it from the shingles. Isn't that amazing? Okay. But you got to remember that
Oh, really?
because you're not going to let anybody near you or near that because it's so painful.
Yeah.
Just taking the clothes, brushing up against it sends pains through your nervous system from your skin. That's unbelievable.
Oh my God. I was told by my primary care that because I had the chickenpox after I was 16, I was an adult, considered an adult. The shingles shot, I couldn't get it at this time. That's what he told me. So it wasn't recommended for me because I had the chickenpox as an adult. I don't know.
Well, I would ask my primary care doctor to look into the what's going on and what the
No, I
suggestion-
think I'm going to be
Because you can.
eligible for it, but I have to wait until later. It wouldn't be effective right now. Like, I don't know what the reasoning is, but that's what he told me. So I'll
50
probably
years,
get-
50 years of age under any circumstances.
Oh, okay. Well,
Okay.
he wouldn't give it to me.
Well, you probably check your antibody for
Yeah.
chickenpox.
Exactly. Yeah, that's
Can,
true.
can I just add one thing? It's Marie Claire. I
Yeah.
find it unconscionable that Medicare doesn't cover the shingle shot, that you have to go to your Part D provider. And at least my experience is that they don't cover it in the sense that you have to go through your $250 deductible, and then they might cover a small portion of it. I don't understand if Medicare covers pneumonia, for example, the pneumonia shot, the flu shot, why they don't cover the shingle shot, knowing how painful it is and how dangerous it is for us elderly should we contract it.
Well, you're talking about Medicare coverage.
Yes.
Okay. Because I know if you have a Medicare supplement such as Horizon, it does cover it. Doesn't cost you anything. There's no copay or anything.
Well,
Well,
that's good.
For some
Mine doesn't.
reason, they don't cover it, and I don't know why. That's not my range.
It's weird though.
Oh, sure.
All right. What do we got?
It says, when you have diabetes, it's important to check your blood sugar at different times of the day. Usually this is the length of time after a meal to check your blood sugar. Some doctors tell you to wait 2 hours. That is usually recommended, okay? Some just say try to do it during regular regimented time so you don't forget it. You know what the bottom line is? Don't forget to check it, okay? And the finger prick things, you don't even need to do that anymore. They have some now that's unbelievable. They can put things on your body and you just use your phone now to check your blood sugar, and you can do it as anytime and as many times as you want. But the idea is that if you have diabetes, you have to work out a schedule when you should check it, okay? And not just once a day. A lot of the diabetics, especially type 2 diabetics, okay? Well, they'll get up in the morning and before they have coffee or anything to eat or drink, besides that, they will check their sugar then, because that's now had probably anywhere from an 8 to 12 hour thing, you know, so you're talking about dinner all the way until the next morning. It's probably going to be lower, okay, than normal, because then we start having our breakfast, right? So you want to, a lot of times you have to adjust yourself at least 2 hours after, okay, to see if that blood sugar has gone way up. I mean, if you put 3 teaspoons of sugar in your coffee, you don't have to check your sugar, you know it's going to be high. We have to be smart about what we put into our body, okay? A little bit of sugar is not a bad thing for a diabetic, by the way, okay? But that means you have to balance your diet. If you're going to have a carbohydrate, you want to have a baked potato, well, you better not have that half a teaspoon of sugar in your coffee, okay? You just can't do carbohydrate for the day, because you're never going to control your sugar. Next slide. Important for a person with diabetes to have this test done every year to screen for retinopathy. Okay, it's extremely important, even for type 2. Okay, and that's eye exam. What happens so often with our diabetics is that they don't control their sugar, and they don't understand that internally your body is at war. That sugar is traveling through, it's building up cholesterol in your blood vessels. Okay, And one of the things is that it attacks the eyes. And it just destroys vision. Macular degeneration is a big problem in senior citizens that never control their diabetes type 2 or especially type 1. But get that screening, get an eye screening every year, okay? Thank you. Next slide. Condition can result in nerve damage that is caused by having diabetes. It causes pain, numbness, and tingling feeling. Again, it's high blood sugar, okay? And you start getting in your legs, your hands, pins and needles, all the way down then to like no feeling at all.
Neuropathy.
Does a check and they do the pin on the bottom of the foot. What's happening? Okay. You don't feel it anymore. Again, it's all of these type of conditions are all because we're not controlling the blood sugar in our body. And that's neuropathy. Okay. Next, slide, please. Recommended that this urine test be done yearly to check kidney function when a person has diabetes. When you're diabetic type 1 or 2, okay, what happens is that your kidneys are now under attack when that sugar is high. They actually now have a medication that you can take, which is using the kidneys as a flushing agent, getting all the sugar out of your blood rapidly. You don't want it building up in any of your body vessels or in any internal organs. And the kidney is one of the first ones that gets affected by continuous high blood sugar. Okay, so the urine test is to make sure that the kidney is functioning the way it should be. Next slide. Quote, the American Diabetes Association, this target goal for A1C is a 7 or lower. 7 or lower, okay? And if you're doing the blood sugar test, okay, that's the A1C. That's the one test you get like every 3 months. If you're doing daily blood sugar, you know it should be within the range between 86 and 126, preferably a lot less than 126. And you don't want to go be close to 86 because now you're starting to deal with too low, and that can cause some severe problems to you too. Start to get the shakes, you get sweat, you get dizzy, you can pass out. Have to control our blood sugar if we're diabetic 1 or 2. Next slide. Minerals necessary for life, in addition to building bones and keeping them healthy, enables our blood to clot, our muscles to contract, and our heart to beat. And that is what? Iron. Iron. I'm not talking about chewing on an iron bar. I'm talking to having, and let me tell you something, folks. Right now, there's a lot of things going around saying that with this pandemic, if you take this vitamin, you take that vitamin, you take this vitamin, it's going to help you. There's stuff all over the websites and there's stuff all over Facebook and everything else. Anybody that's 55 years of age or older should be taking a 55 plus daily vitamin. It's as simple as that, because it will give you all of the necessary daily requirement of vitamins and minerals for your body. Personally, I use Centrum 55 plus silver. Okay, take one a day. You don't have to do heavy duty supplement vitamin minerals. Okay, there are other type of supplements you may want to use. Okay, but it's not like that. Take that vitamin every day. All it does is help you. Next one. Next slide. This is the only test that you use to diagnose osteoporosis. Okay, anybody know what osteoporosis is?
Yeah.
Think about your back.
Loss of
Thinning.
bone mass.
The thinning of your bones.
Yes, it's usually our backs. Our backs are usually the first thing that go out. Just about everybody has some form of osteoporosis once you get to 65 and older. Some people earlier, some people severe, some people don't even notice it. But if you do, what you can do is you can have a spinal test taken for it. There's a screening, talk to your doctor about it, see what your doctor wants to recommend, because he's going to ask you about symptoms of it. Okay, if you don't have any symptoms, he's going to tell you, no, you seem to be okay. If you might have some symptoms, he or she might tell you, let's get screened for that. Next one.
Bone density.
Bones good.
Non-impact activities can improve your coordination, flexibility, and muscle strength. It can also reduce your risk of falls and fractures. What were you just doing before I came on?
Yoga.
It's a great thing for us. It's a great thing. it's movement, it's exercise, and I like to get on early so I can do the meditation, which is, did you know I was doing that? Early, and I love the meditation part, how she ends up. She's great. I love her. Next one. Following disease or conditions can put you at risk for osteoporosis: rheumatoid arthritis, lupus, multiple sclerosis. Okay. If you have any of them, you're going to have to be very, very careful. And I'm sure your doctor will be talking to you about it. Hopefully that doesn't happen. Next slide. Vitamin plays an important role in protecting your bones, both by helping your body absorb calcium and by supporting muscles needed. And that would be vitamin what?
D.
B. Yep.
D.
Yes, in David.
Yep. Vitamin D.
D. I said that.
You also say vitamin B is good. Again, I'm just going to tell you, take that 55 plus vitamin every day, and you're not going to have to worry about any of these extra things. It will all be in one little pill that you take in the morning with your coffee. Next slide. Are there any questions? I'll tell you what I got today. I listened to you talking and about how to keep track of things and stuff like that. I think I'm going to be putting together a PowerPoint on tracking your health. Where your records should be and what your records, who has your records. I think that'd be something that would be very, very good. I know, like when you were talking, I didn't want to interfere because I wanted to interact and let you folks speak. What I do is I go to my computer and I do a whole list. The first thing I do is all the surgeries I've ever had. Okay, starting out with tonsils when I was 6, going all the way up to my last surgery that I had. And I put the date, just a month and a year, okay? And then I go to any diseases that I may have. For instance, diabetes type 2, I had pneumonia and that goes next, okay? And then I put down immunizations I've had, when I've had them. And then I put down all my doctors' names and phone numbers. And anytime I have to go to a doctor, except my primary care, because he has all that information already, I have that with me. I actually have it in an envelope that I keep in the glove compartment of my car. And I have copies on my computer that I can print it out anytime I need it. It's a great way of keeping your own records and going to it. I don't want to sit there and write out form after form after form every time I go to a doctor. Okay, I just went for a biopsy of my prostate cancer. I forgot to bring that with prostate gland. I forgot to bring that with me, and I had to sit there for like 20 minutes figuring out everything out of my head when I did this, when I had that, and stuff like that. Case closed. I was so mad I didn't bring that with me because I had to fill those forms out. Normally, I just say, see attachments, and I hand them the forms back after I give them name, number, address, and so on and so forth. Works tremendous. Try doing that for yourselves too. Okay, and your medication. Put your medications down and how you take them, when you take them, and how much you take. Okay.
I do the same thing, Vince. I mean, I'm retired now, so I have it in my computer, your allergies. And at the end of the year, I always make a summary what happened that year, so that and every time I go to a doctor, I just give them a copy of all my history, so they don't have to ask me all the questions.
Exactly.
All the list of the medications, my surgeries, and everything that I've had in the past.
Yep.
Great.
Well, I'm usually a very patient person, but when I make something up like that and I put it with the records, like I just said before, I had to go to a urologist because I thought I had some problems. I wanted to make sure I got my prostate taken care of. He checked it out, symptoms, so on and so forth. So when I went to the new doctor, who I do like, but we had to have an understanding right away, I went in and sat down, here's these 6 pages of forms. I made it into 1 page, name, address, blah, 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 blah. And then I said, see attachment, and I put that with it. Mm-hmm. When I go in to see the doctor, he's got all this stuff in folder, and he says, well, he started asking me questions, and I said, did you bother to read my folder, doc? Mm-hmm. I mean, he goes, what? As you're asking me questions that you asked me on a form, and all the answers are there. I says, and they're even better than your form because I gave you everything. I said, you know everything about me now. And I feeling that in another 5 minutes, you're going to know even more about me. So, and he did. But the bottom line is, like, after that, he looked at me and he goes, I wish everybody did this. He says, I see C attachment. He says, and I figure most people don't even have the right stuff down.
Mhm.
I said to him, well, you don't know what I do for a living. So anyway,
Well,
we
my
very
suggestion,
nicely after that.
That is-
Um,
that is a good thing that you question the doctor, because most people feel like the doctors do what they need to do and you just listen. But it's good to have a conversation going with him and asking.
Oh, absolutely. That's one of the things, one of the programs I do is called effective doctor visits.
Yes.
There's people, especially older age, that were taught that you went to the doctor, you sat down and you just listened to what the doctor said and you left.
Right.
No, you have
No.
the right to really know. You have the right to say, like, Doc, bring it down a little bit. I'm not sure. I don't understand it. For instance, when this guy was talking to me about having the biopsy for the prostate gland, he was telling me 3 different ways. And I knew the 3 different ways, but I said to him, I said, but tell me, what's the advantage of each one? What's the higher rate of infection with these type of things? And he looks at me and he goes, He says, most people don't ask that either. I said, well, here's the $1 million question. If you were me, what would you do? Okay. I don't challenge them. I talk to them. I question them. They question, they answer. But I can tell you this, when I went for my knee surgery and I asked the doctor, the surgeon who was going to do this thing in his office, I said to him, I says, I have a couple of questions. He goes, oh no, we're going to send you to a course. He says, you're going to spend like an hour and a half here at the hospital, probably next week. They're going to say, and they're going to teach you all about this. Oh, whoa, Doc, no.
No.
I'm going to make my mind up whether I want to have it, number one. Number two, I want to make sure where I have it, who's doing it. I said, so I'm asking the first question. You doing it, or one of your students in this hospital going to be doing it? And he looked at me and he goes, well, I'll do it. I says, okay. Now I got some other questions. No, he said, I don't have time for questions. I have to have the patients. I says, well, you just lost this one. And I walked out and I took the papers, gave it to the nurse. I said, don't schedule me. I'm not using this doctor. And he was the head of this department in a very reputable hospital in Monmouth County. Okay, I won't say who, where. Okay, I won't.
I think that the thing to remember.
And that forced me now to go to special surgery in New York City. I wanted to stay local in Jersey. I didn't want my wife traveling back and forth to see me over there. But and this guy was supposed to be really good. If the doctor won't answer your questions, get the hell out of there. Run out of that office and get another doctor.
And we have to remember that we are paying for it, even though you don't have a co-pay and you think it's free. It's not free. You are paying for it, or Medicare is paying for it. And he needs to take the time out to answer your questions.
Well, I agree with you. Yes, we're paying for it, even though it's insurance.
Yeah.
Yeah, somebody.
What we really need to do, I don't care about the pay, is our own self-education, our own self-knowledge. So we know what's going on, okay? That's like, well, you can't believe how many times I've had to go to doctors with friends because they don't know what to ask, okay? Or they went to a doctor and they got a diagnosis of cancer. And when a person gets a diagnosis of cancer, you just shut down. You don't hear another thing for the rest of that visit.
Can I make a suggestion?
It's all right to know this stuff.
Yeah.
The doctor says, oh, I don't have time for questions. You don't have time for that doctor. Get the hell out of there.
Somebody wants to make a suggestion? Who is that?
Vanji.
Hi.
I'm a retired nurse. So when I go visit a doctor, I write down the questions that I have for the doctor, because when you get to the doctor, you get sidetracked with her talking to you, and then you forget what you need to know and what you need to ask. When you get home, you get so frustrated because you are left in a limbo and you don't have any answers for yourself. So write it down in a paper when you're going for a doctor's visit.
And
Yeah,
don't
absolutely.
take it out when you're right there with him, because once you get home, you get frustrated because now you have to call. They don't answer your call.
Yes.
Here's more suggestions. We sometimes forget our symptoms when we go to the doctor. Write your symptoms down too.
Yes.
Another thing I'm going to suggest that you do, and it's perfectly within your right to do this, okay? Just make sure you have a mask on. When you go to the doctors, bring someone with you. Have them go into the office with you. your husband, your wife, your son, your daughter, anybody, okay? That will be that second set of ears and that second brain that will be able to assist you. The doctor shouldn't have any problem with that, okay? It's as simple as that. The only thing doctors will not permit you to do is record the appointment. In other words, you can't go in and sit down and talk to the doctor and say, can I record this? That they're not going to allow, okay? For common sense and legal matters. Their insurance company doesn't let them do that.
Recording not,
You
but
can
when
take
I go,
notes. You can
when I go with
take
my-
notes and stuff like that.
but when I go with my husband, I sit there and I don't say a word, but I write down things because my husband is busy listening and I'm busy writing. So at least
Right.
have a record of it without recording it, you know?
Yep.
Okay, Michelle, you mentioned about not getting a result of your blood test.
Yes.
We as patients are entitled to have copies of the tests that we undergo. You are entitled to have a copy, so you should request for a copy of your blood test.
No, I got it. It's in my portal. We have a portal. I
Right.
have Horizon Blue Cross and it's in my portal, but I can't find whatever line. I can't read it. And I keep calling the doctor saying, could you just look at it and tell me? I know it's there somewhere, but it's all gobbledygook to me. And I'm assuming that when they did all they ran all the tests on my blood, one of those things, but I can't seem to decipher where that is on the report. And so when I call them, I always, I get a receptionist or somebody that, doesn't take the time to help me. So it's really
Okay, there is a record department in the hospital that you can call.
Okay.
They can give you a copy. Sometimes they might charge you a little fee, but if you
Yeah.
know when the date was done, you could ask for a copy of the blood test.
Yeah, that's a good idea. Thank you. Well, this is food for thought, right? For the next one, Vince, people really, really getting the most out of your visit and really preparing your records and, having those list of questions. There's so much here. I want to mention before we go that I did look up that article, and it was a nonprofit, but interesting. Maybe we'll do a program on how to sort of research your research, how to look at with a discerning eye. Things like, Vince says, this is an advertisement. Are they trying to sell something? Are they trying to kill somebody out of the, trying to, maybe ding the organic chickpea association? Like, sometimes things are disguised as nonprofit. This particular place is called the Environmental Working Group. It's a nonprofit, nonpartisan. So they say research group that has a vested interest, obviously, in health and wellness, but we'll talk about that tomorrow a little bit in our food talk. But this is also another topic that will probably come up with our dietitian, talking about organic food versus non-organic food, what to look for. There is, according to this article, though, you're better off buying organic chickpeas if you can. So you always have a better chance at, the thing is, they're not allowed to use the pesticides, which in this case is glyphosate, which is Roundup, right? The Monsanto, now the Bayer company. They're not allowed to use that pesticide on the chickpeas when they're harvesting, but many times it's it's already in the soil from past. It's already in the, sometimes there's runoff that they can't prevent from other fields or other growing fields. So sometimes they can certify something organic, and they, all of those boxes aren't really checked because there's things that are out of their control, or they just don't bother to literally dig a little deeper into the soil. So there is like trace amounts of this chemical in even organic, and apparently the growers can't always control completely. But anyway, we'll talk about that tomorrow, making Indian food tomorrow, if you want to join us. Today at 2:00, we have a program, the New Jersey Folk Life program. It'll be winter Italian songs and stories, live performance and storytelling. So that's at 2:00, same portal, same place. And That's all I got. Vince?
Michelle, it's Marie
Yeah.
Claire. I have
Yeah.
one last question for Victor.
Vince,
Victor,
yeah.
Do you have any recommendations on how to source the best medical professional, whether it's a GP or a specialist? How do you go about finding the best doctor aside from asking a family member or a next door neighbor?
Well, there's no rating system that you're entitled to look at from your insurance company. Okay. And Medicare doesn't have that. But if you have any company that's supplemental like Braven or Horizon or Aetna, they don't rate the doctors. That is up to you entirely. It's best to ask around. Okay. Seems like every town has on Facebook a thing like where I live in Middletown. It's called Middletown Patch. You might have Montclair Patch. In fact, I know that you do.
Yeah.
Montclair Patch. You can go on there and you can pose a question. New to town, okay, or original general practitioner, retiring. Any recommendations on who is a excellent GP to go to now? And you'll get a lot of ones, and you'll see that some will get a lot, some will get like not hardly a few, and you'll even get a few like say, stay away from him, stay away from her. So you gotta be able to sort it out yourself. But there's no rating system on doctors. It's not like saying it's like cars. You gotta go by.
Yeah, it's like anything else, Marie Claire, crowdsourcing. I always like, I hate to do this, but, I go to a restaurant, I look at what other people are saying, and then I don't take one bad review. I look at all of them and I look at the number of them. There's, 3,300 ratings for this doctor, and like 10 of them are bad because they didn't take their form of payment or something obscure, or there was a long wait I look at those things that matter to me when I crowdsource. And health grades, a lot of times there are different, health related crowdsourcing platforms that doctors are using. ZooDoc is another one. So there's, you can put a doctor's name in, and then you'll get these 4-star, 5-star, 3-star. But you have to take everything, like Vince says, and do your own research. And, you're going to get disgruntled patients all the time. And you put them in the chat, like Vince says, the Facebook groups, and you can kind of get a sense of who's popular, why they're popular. I direct message people all the time on Facebook and say, why do you like this doctor? How's their bedside manner? Is there a long waiting? There's certain things that are important to me. Do they answer? Do they listen? You can ask somebody that's been there, or ask more than one person. So sometimes, like with all the social media crowdsourcing, reviews, getting those reviews, but really looking at them with an objective eye is the way to go. I think putting all that information together and then making a decision. I would have to say, and I think Vince would agree with me, a lot of those like New Jersey magazines that have the top docs, some of those docs are paid. It's paid advertising, right? They pay to get the bigger picture and the group of the office, and they get their patients to write. They're the best doctor. It's a popularity contest in many cases, not always, but you have to be wary of whose picture is the biggest, glossiest, nicest picture is who paid the most money for that. It's an advertisement. And it does say that in the magazine. This is there is a disclaimer there saying that it's advertising. So
very tiny print in the bottom.
That's right. Anyway, thanks everybody. The Italian concert, I believe it will be recorded. I'm not 100% sure, but I think they gave permission to have it recorded. So if it is, Jeff, to answer your question, we will have it available. So anyway, thanks, Vince. I appreciate it. Have a great day.
Thank you, and Happy New Year's to everybody. Be safe.
Thank you. Thank you.
Wear your mask.
Yep.
Michelle.
Yes.
Bye now.